Dr. Rachana Kulkarni, welcome to ITV Gold. I hope you're doing well today.
Thank you, Aditi. Always a pleasure to be here.
Always a pleasure to have you. So let's go right into it, Doctor. My first question to you has to be about the increase of cases we're seeing nationwide. Obviously, we're talking about a lot of unvaccinated population that is getting sick right now, but these numbers are really high. I'd like to know what you're hearing from these states, Doctor. What are the conditions of the hospitals? Because I know you have friends and colleagues in those hospitals. And what should we know about this?
A couple of things. The consensus across the board for medical community is that most of these cases are coming from unvaccinated people. Just look at the state data that 99% of COVID-19 infections are coming from unvaccinated. 99% of hospitalization is coming from unvaccinated people. So it's extremely important for us to know that how much protection a vaccine gives to people. Having said that, we are also seeing a surprisingly increased number of COVID cases in young kids. So it's important for them to get vaccinated as well. This has put an already tired medical community at the brink of collapse, especially in certain states. Texas, we look at the Dakotas, we look at Florida. The hospitals, the ICUs, are functioning at capacity. Also, we have to take into account caregiver fatigue. The medical community has been battling this infection and this virus for last year and a half. And having served in the ICU and seeing these things firsthand, we are tired, we are fatigued, and our resources are being stretched also. So my urge to everyone who is listening is to get vaccinated. That's the only way we can contain this virus. That's the only way we can finally see a light at the end of our tunnel.
You know, Doctor, let me ask you this. What could be the worst case scenario over here in this situation?
The worst case scenario is what we have already started hearing in the Dakotas and in Alaska, that medical professionals have to start rationing care. And that's not something we hear about in the United States. We had seen that at the height of COVID infections on the Northeast coast also, where we were the first one to get hit hard. And now we are seeing that in Alaska, we are seeing that in the Dakotas, that care has to be rationed. Ventilators are in short supply. And that's my biggest concern, that people who need care may not be able to get care just because the system is overwhelmed.
Yeah. You know, I'd like to know what you as a medical professional would like to tell everybody who is against mask mandates, against vaccine mandates, against getting this situation controlled. How does that make you feel?
At this point, I believe that the numbers, the science speaks for itself.
Right.
99% of the new COVID infections are in unvaccinated. At this point, 1 in 500 people in the United States have died of COVID infection. So COVID is real. And the vaccine is the answer. The mask mandate is the answer to contain this infection. This is the only way we can get ahead of it, because what happens if we don't take the vaccine, right? The virus jumps from one host to another. That's the way viruses mutate. So if we capture or if we conquer the Delta variant, there is a Lambda variant that's waiting in the wings and a Mu variant. And if the virus has opportunity to jump the hosts in unvaccinated people, that's how it mutates. And it becomes an increasing challenge all the time for scientists to figure out a remedy.
Yeah, again, vaccine is such a key and such an answer. Just talking about the vaccine, Doctor, I have to ask you, the biggest news that's going on in the country about vaccine is about the third dose, the booster shot of COVID-19. We hear that you should be getting the shot 8 months after your initial dose of the COVID-19 vaccine. Right now, we're looking at people with underlying conditions or conditions such as cancer who are getting the third dose or will start to get the third dose. There's a lot of debate about if we need it or not. How are you looking at this?
Historically, we have seen that some vaccines do need multiple doses. Just to give you an example, hepatitis B vaccine needs booster doses after several months. So does HPV. Many of our vaccines, very few of the vaccines, let me put it this way, very few of our vaccines are single dose vaccines because the body generates the immune response, and then with the second dose, you augment response, and sometimes a third dose is needed. I do strongly believe that COVID will be something we may need 3 doses as to augment our immunity. The studies in Israel have clearly shown that there is benefit to getting a third dose to get our immunity level up after 6 to 8 months. The CDC is meeting to finalize their recommendations. At this point, it's authorized for immunocompromised people, and they for sure definitely should get it now. And then we will wait for the government recommendations. But it is not a failure of the vaccine. It's not something that people should think, oh, they told me 1 dose and second dose, and now asking me to take third dose. We are learning about this virus, and we are evolving our knowledge, our database as we are going along. And a third vaccine is not considered a failure. A third booster shot should not be considered a failure. It should be an additional layer of protection that is being offered to us.
So how would then the future look like, doctor? Would this be 3 doses per year, or every 8 months until indefinitely we are taking the COVID-19 vaccine? What are you hearing in the medical community?
Needs to be seen.
Okay.
But we definitely see 3 doses to begin with, and then probably a yearly flu shot like COVID shot.
Okay. When we're talking about flu shot, let me quickly ask you this. How important do you think it is for us to get our flu shot this year with COVID-19 again surging in the country?
Extremely important. Flu is the biggest cause of morbidity and mortality in young and immunocompromised people. That's the biggest cause of death and flooding our ICUs during winter months. Last year, because of the mask mandates, a lot of people did not get flu, and it prevented overwhelming our systems with that burden. I would strongly urge everyone to get their flu shots. It flattens the curve of hospitalization. And keep in mind that the symptoms of flu and COVID can be very similar. It sets another round of panic in people around you. Unnecessary testing will have to be done. So just take your flu shot and take your COVID booster shot whenever you are eligible.
Basically, take the vaccines that the doctors are recommending because they're recommending it for a reason. Doctor, let's now quickly talk about something
If I may just add here, just an example how science works. We don't see polio cases that we used to see.
Right.
Not you, but probably me. In our childhood, we don't see that. Those cases. Why is that? Because we have a vaccine. We don't see diphtheria. We don't see chickenpox. We don't see a lot of illnesses that used to stunt the growth of the children or cause untimely deaths for young children. We don't see that kind of mortality as well as morbidity. And that's because of science, because we have vaccinated our children against all of that, tuberculosis, and all of those deadly illnesses are under control because of vaccines. And I don't see why COVID couldn't be if all of us are vaccinated.
Right, and you just mentioned children. I want to go into the rise of cases and critical cases in children where hospitals in states such as Florida are filled with children as their patients. Is it because we're not vaccinating enough children? Is it because the schools have opened up? Is it because the parents are not vaccinated? What is the real, answer behind this?
It's a combination of all of the above. There is trepidation in parents to vaccinate young children. There are so many myths that go around about vaccinating, right from infertility to a multitude of things. The chances of that are even myocarditis. They are so rare. However, the protection that this vaccine offers to the children is so much more that I would urge all the parents to consider that. Please also know that there is a surge in younger people, and we are worried about the after effects of the vaccine. But I would urge those parents and those young individuals to consider that, have you overlooked the long-term after effects of COVID? Pulmonary, neurological, cardiac. So do please consider that before you choose not to vaccinate people.
Yeah.
We have opened up quickly, which is okay. Life has to go on, but mask mandates should be enforced in school because it's close quarters. A lot of young people are there in a very closed environment, and I do believe that if we mask and vaccinate as much as possible, we can still continue to have some sort of normalcy to our life.
Yeah, wearing the mask is so important. Doctor, when can we expect any results on children under the age of 12? Because obviously vaccinating them is also of utmost importance here.
At this point, the recommendations are that children over 12 should be vaccinated. And I would update you that at this point, Pfizer is looking for authorization to vaccinate children over 5, because that's a difficult age. These kids are in elementary school. How can you expect a 5-year-old to wear a mask for several hours a day? Get them vaccinated, ask them to put on the mask, but give them all the protection they need.
Yeah, that's so important. Just talking more about this, doctor, vaccine mandates, again, are up for debate all across the country. There are many federal officials that have to now get vaccinated as per President Biden. In the state of Florida, if an employer tries to get their employee vaccinated and, they not only just recommend, they demand it for them to work there, they may be fined by the governor of the state. How are you looking at the involvement of government in all of this? And, what should they be doing according to you as a medical professional?
The government should listen to science. And science and healthcare should be free of politics. Unfortunately, our country has moved in a different direction, but people's health should not be used for political purposes.
Yeah, that's so important. It's so important to hear that. We just mentioned Florida. I had another question about Florida. Many people from the Northeast, or just the North in general, like to move to Florida when the winter season arrives. They're called the snowbirds. How are you looking at that community of people? And do you recommend that they travel to these warmer states such as Florida and Texas for the rest of the year, or should they stay where they are amongst more vaccinated communities?
Excellent question, Aditi. New York, New Jersey, they're full of snowbirds. People after fall, right around Thanksgiving, people start going to the warmer climates, and I would love to follow that. However, this is a different time in the history, and if possible, avoiding travel to Florida, Texas is advisable. However, people have to make economic decisions, and for tax purposes, you have to fulfill certain number of days in your residency in Florida, and I understand that. In case if you need to make that travel necessary to fulfill your days, then please do consider uh, getting your flu shot. Protect yourself as much as possible. If you have underlying conditions or if the booster shot opens up, do take the third shot to complete your vaccination. And when you are in Florida, when you are in Texas, please know that these are the hot spots and the healthcare system there is stretched. So please uh, practice social distancing and wear the mask. It's your responsibility. I always believe personal responsibility to protect yourself, your loved ones, and your friends. So protect yourself as much as you can. I'm saying vaccine both for COVID as well as flu shot is like you have to travel with your seatbelts on, right? You would not even think about traveling without your seatbelts on. It's just like that. Or if you have to make that journey, put your seatbelts on.
Two more questions left for you, Doctor. I'd like to know, how are you looking at the Northeast and other states that have a lot more population that's vaccinated as comparison to states in the West or the Midwest or the South? Do you think we can also be in trouble later on if the surges continue to happen in these other states with the unvaccinated population? What can be the impact on vaccinated people?
For definitely, New York, New Jersey are a lot better as far as the vaccination scene is. More than 65% of the population is vaccinated, which is wonderful. But this is the season, Thanksgiving, Christmas. These are the seasons where families travel, meet each other. So there is going to be a lot more airline travel, a lot more mingling of the population. And let's not forget that New York is a very popular tourist destination during the holidays. So we are going to see a lot of influx of people from other parts of the country and from the parts which may not be vaccinated or are hotspots for COVID. And if that is the case, we definitely will have a significant spike here in the Northeast also. How do we protect ourselves? Try to get complete vaccination with the third shot. Protect yourself and keep in mind, masks are fine to protect yourself. Good news is people, even if they get vaccine, if they get COVID infections, if they have completed their vaccination, chances of having severe COVID infection that needs hospitalization are very, very small.
So while talking about the flu shot and the third booster shot, they're going to sort of fall around the same time. Do we need to have any gap, or could we take it at the same time or a day after the other? What's your recommendation?
At this point, the recommendations are that it will be advisable to have a 2-week gap between the flu shot and the third booster shot. Flu shots are being available now, so my recommendation is get the flu shots, wait for 2 weeks, and then get your third shot. The reason is that we don't know how everyone reacts to either the flu shot and the booster shot. So it's better for us. It's easier on the bodies also to space them apart with 2 weeks.
Yeah, definitely. My last question to you, actually, I'd like to know your prediction for the next month or so. We have about 54% of population vaccinated, fully vaccinated so far. Do you see that number grow, and what's going to happen with these case numbers that we keep on seeing go up?
That's a huge concern for us. So I'll share with you that in June, we had less than 200 cases of COVID. At this point, after the July 4th holiday and after the summer, our average cases at this point are 2,100. Wow. So in the few months, we have seen a 10-fold increase. And this will continue if we continue to have big gatherings, big surges, and a bunch of vaccinated and unvaccinated people getting together.
Yeah.
I do understand that for economy, for our overall economic as well as mental health, things need to open up. We need to have some sense of normalcy. So at this point, getting completely encouraging as many people to get vaccinated, including children, is the way to overcome this obstacle.
Yeah, definitely. Vaccines.gov is the website. You can find information to get your vaccine shot and the location. Dr. Kulkarni, thank you so much for your time today on ITV Gold.